Welcome, ladies and gentlemen, back to USMMA EMS Training Online. We're going to start off Season 2 with a three-part mini-series called All About EMS. Part 1, we're going to be doing breakdown of watch team refresher, teams, and just how to get your crew chief certification. So this doubles as the crew chief cert. Don't worry about it. Just pass the little written test we have, and then all second classmen who are currently EMS certified can be crew chiefs for this next coming trimester. These are the requirements. Like I said, it'll be on the test, so just answer true false if you have these certifications. And let's get started. The watch team. Tip of the spear, driver, and rider, also known as a technician. Right after that, overseeing it is a crew chief, and then at the tippy top, or the bottom of the pyramid, I should say, is the supervisor and EMS officer. Kind of making the protocols, standard operating procedures, making sure you guys have all the tools and the knowledge you have to succeed on the daily watch team grind. So the duties of the tech and the rider, they directly assist the crew chief with patient care, make sure the scene is managed with that crowd control, making sure everyone's in the right spot, helping out with general procedures like doing vital signs, putting on C-collars, setting up oxygen, carrying bags, stopping bleeding, anything day-to-day, whatever the task may be, the driver or the rider and the tech can help with that, whatever the crew chief decides. Duties of the driver are to literally drive the ambulance safely with the watch team and the patient to the scene and as well as to the hospital. The drive is pretty easy. Straight out of the gate, take Steamboat Road up to here. It's pretty narrow around here with the cars parked on either side, so watch out. Take a right on Middle Neck, and then immediately take a left on Hicks Lane. Meet East Shore Road, and then just ride it all the way down. Be careful with this Northern Boulevard intersection. This gets pretty busy, so if you can, turn off lights and sirens if you are, and just wait for the light to turn green, and then pass safely. Go ahead and take the ambulance entrance or emergency into North Shore University Hospital, and then back it into place safely with your patient. So they provide manpower, moving patients, whatever the equipment they need. So scoop, reeves, anything like that. Stair chair, stretcher, helping out with movement of that. And they prepare the ambulance. Now that it's cold, it's wintertime, you want to make sure that the bus has heat if the patient is hypothermic or just a little cold. So lights, interior and exterior, make sure that master switches up, and then either lighting the outside or inside of the area. Bus placement, make sure the bus is put in a safe spot where they can easily be exfilled and the patient can be loaded on safely. Big thing in safety here. And the duties of the crew chief. They are responsible for the entire watch team and the patient care in and of itself. They communicate with Vigilant, the watch team, over the radio, let Patton know what's going on, and also communicate with Medcom when they need assistance or advice. That is the radio on the inside of the bus. Documentation. They are in charge of the PCR, and they make decisions. So be that a load and go, stay and play, are they refusing medical assessment? That's the job of the crew chief to identify and act upon. Patient care, obviously. Patient movement. What kind of patient movement devices do you need? Do you need the backboard, the stretcher, the stair chair, the scoop, the reefs? What do you need to adequately and safely move the patient from one area to the other? Patient transport, ongoing assessment. Always looking at ABCs, always looking at vital signs. And the transfer of care, be that a higher medical, like a nurse, or ALS. Duties of the OIC, officer in charge. So this person, usually an EMS officer or one of the first classmen, they are overall in charge. So kind of just looking out for the watch team, making sure that they're all doing good and they have all the tools they need to succeed. Making sure the bus is fully stocked and all that juicy stuff, all that logistic stuff. Responding to the call. So this beautiful base, Great Neck Vigilant Fire Company, For all the 23 Bs that have never seen this place, this is it. This is on Cuttermill, right next to the train station. And in this box here is where the dispatcher sits for about 12 hours a day, drinking coffee. He's typically a crusty dude. Just kidding, we love him. And they get the calls, the 5858 number, and they dispatch it to us on the watch team. So you hear Signal 9A, Merchant Marine Academy, that's them giving the call. This is it, the pager goes off. The crew chief or OIC will call the dispatcher that just toned us out and say, hey, okay, we got you. We're headed to the scene now. Make a call over the radio. Just repeat what the dispatcher said to let you know where the call location is, what it is, what kind of equipment you're going to need, and who's making their way to the scene and to the bus. Make sure you walk. Do not run. Running is unprofessional. Kind of shows that you're not in control of the situation. So calm breeds calm, and making sure that you guys are taking a deep breath and assessing the situation, not in an emotional way, but in a tactical way. BSI scene safety for us right now with COVID protocols, we're at least going to be wearing the masks and then donning the gloves. So that's the bare minimum, as well as BDUs, full BDUs, blouse, pants, and then steel-toed boots. Assuming command, we'll go into this later about the EMS officer or the crew chief getting on scene. Patient care, make sure you find out what's wrong, decisions, where are they going, what's going to happen, and documenting everything that goes along with that. Scene safety. So first priority is the watch team and as well, similarly, the patient. For right now, since it's wintertime, we're going to be really worrying about ice on the roads. So making sure you're not sliding or in a predicament where you get stuck in the snow. Call for additional resources. If you're stuck, we're probably going to call fire and DPS to help us get out of there. But other stuff for that later on. Ensure BSI is worn by everyone on the call, so make sure that's a crew chief typically. They'd be like, okay, everyone, if you don't have a blouse on, make sure you put your blouse on and get your mask and your gloves on. Assuming command. So if you're not the first person on scene as a crew chief, then take it from whoever is there. Is it another midshipman? Is it a CO, EMS officer, petty officer, whoever it is, just ask them what's going on and then transfer the information onto your patient care report. So you're in charge, be confident, be respectful, be professional. And then if necessary, seek advice. If you don't know what's going on, just ask. Patient care, crew chief is ultimately responsible. Obviously, make sure you're following your local BLS protocols, monitoring the patient at all times. Take interventions. Obviously, do what you got to do to give your patient the best medical assessment possible, best treatment, best everything. And number one rule, do not harm. So if you do nothing, do nothing. Leave the patient in a better situation than you found them, if you can. Responsibility for patient. When are you relieved? When the RMA refuse medical assessment, you give it to a nurse, they sign the back of the white copy, or an ALS provider, same thing, sign the back of the white copy. And if you need advice on a call, just say, oh, I see the scene. If not, if it takes a little while or you're just unsure, just fall back on your training. AVPU, you got your levels of consciousness, alert, verbal, pain, unresponsive, AVPU. C-spine, did they hurt their neck? Did they fall? Just palpate, check it out. If they are, put on a C-collar. Airway, adjunct, you remember OPA, NPA, breathing, difficulty breathing, look, listen, feel. You got your oxygen therapy. Circulation, control bleeding, look at the skin, see if they're in shock. And decision transport. Remain on scene to assist if necessary. This is important. So if you can, write this down or just remember this, put it in your phone, do something. Refusal of medical assistance. So these are people who have implied consent. Basically, they cannot refuse medical assistance. You are their brain. You are thinking for them. This is the decision to go to the hospital. They are without that decision. They have to go. These are people with altered mental status. These are people less than the age of 18. People who attempted suicide, danger to themselves or others, homicidal or suicidal. Acting in an irrational manner with that they do not have the capacity to make medical decisions. Unable to verbalize the understanding of illness, unable to verbalize rational reasons, and they have no legal guardian available. If you can, document. This is very important for someone who cannot refuse medical assessment. And the patient and witness. Oh, of course, yeah. This is if they can refuse medical assessment. So they don't meet those criteria listed in the slide previous. They have the EMT make sure they understand these bullet points here. Patient understands the consequences of refusing medical transport. So you'll typically write most of this on the PCR. They were offered transport to the hospital. EMS offers transport. EMS explains risk of refusing transport. EMS explains the possibility of serious injury. EMS advised to seek medical attention. EMS confirmed that the patient understood, and EMS left the patient a responsible adult. EMS advised them to call again if they wish to be transported. Transfer of higher medical care. At the hospital, nurse, sign the back copy. In the field, ALS, and then just make sure you get a signature from either of those. Types of transport. We can only transport midshipmen. That's pretty much it. You can only transport midshipmen. If it's a non-midshipman, call for vigilant bus. They typically ask that on the call, so they'll already be dispatched. Emergency calls, Great Neck Vigilant Dispatcher will tone it out. You'll give, so lights and sirens is authorized for 21, which is to the scene and then to the hospital. Try not to use lights and sirens while you're on campus if necessary. PCR is required to be filled out on every call, must be filled out, obviously. Signal is 21, which is going to the scene, 22 at the scene, and 18 is back in service. Should be given over the radio, at the very least, over our EMS radio. They will be given over vigilant radio to let the dispatcher know what's going on. And you'll give the patient the get-home paperwork. The get-home paperwork is just a folder that tells them who to contact, how to get home. And for them, it says what hours of Patton, what to call for Patton, friendly taxi number. And for right now, since friendly taxi has been not too good to us, we have been giving them the EMS phone. So crew chief or OIC, giving them that number, and then they can call it, and then we can take care of our own. Upon arrival, check in with the CDO, make sure they know the accountability, and check in with Patton if necessary. Go back to sick call. For non-emergency calls, and then I'll just emphasize this, for during COVID hours, we do what we can. The EMS officers and OICs will pick up the slack for friendly taxi or whatever. So we can drive people to appointments, but that's kind of like a last resort. Fill out PCRs on all calls, notify vigilant, back in service. So for emergencies, you do it over the radio. And for non-emergencies, you can do it by phone. Just call that business line. Notify when the MM1 is back in service. And that is it for part 1. We will begin part 2 momentarily. Thank you, everyone.